I'm Kate Meller, and I'm the Chief Commercial Officer here at Alma. I spent most of my career working on the payer side of healthcare. I've often found that in every role that I've had at every organization, I sit between two big stakeholders in healthcare, whether it's employers who purchase services from payers or whether it's between providers and payers. And it's my job to be that translator to find the common ground between those two stakeholders. I do that now at Alma. I sit between the clinician community and payers, and I try to speak both languages and help find the common ground. It's my belief that when you can speak the same language, you can work together to create value. Healthcare in the US is incredibly complex. I'm not sure that there are more than a handful of people who can understand the complexity of the system deeply. As a clinician, you have a different, and I would argue more important job, right? And that's to care for patients. Our job is to be your translator. Our job is to be looking at what's happening in the healthcare space, finding those trends that could impact you, and surfacing information to help keep you informed. Because when you're informed, you can make informed decisions. To try to understand the system simply, start by understanding who pays for care. And so I think about the federal government, insurance companies like UHC and Aetna and Cigna, and employers. And the reason I focus on those three macro forces is because they are often the three entities that are making decisions about how money flows through the system. The federal government through programs like Medicare and Medicaid, payers through the insurance programs that they administer, and employers, because oftentimes employers are the payer behind the insurance company. Employers are self-funding. In other words, they're paying for the care that their employees are receiving, and the insurance company is just an administrator. 40% of all healthcare spending in the US is paid for by the federal government under the Medicare and Medicaid programs. 40%, right? It's a big chunk. So it's important when you operate in healthcare to understand what these government programs are and the impact that they can have in all parts of the system. So I know a lot of us know this, but just for clarity, right? Medicare is a program that covers over 65 individuals and is paid for by the federal government and then in turn really paid for by taxpayers. And Medicaid is a program that covers low-income individuals and those with disabilities. And again, is joint funded, partly by the federal government, but also by state and ultimately by taxpayers. So I'm just going to focus on Medicare because I think what's interesting about Medicare, or one of the things that's interesting about Medicare and how it can influence other parts of the system, is that Medicare sets, as a federal government program, it sets a national reimbursement structure. What Medicare does is they decide how much as a program is Medicare going to pay doctors and other clinicians for each service that they might provide, because Medicare is a payer. And why this matters is because payers often use this national Medicare fee schedule, which is published and publicly available, as a benchmark for how they set reimbursement rates for commercial plans. So we pay close attention to Medicare programs because of that impact on reimbursement. The other entity that is a payer, or the other entities, are employers. So sometimes I like to think about employers as the payer behind the insurance payer. And what I mean by that is that employers often pay for the benefits that their employees use, meaning they actually pay the claims. And what the insurance company's job is to be an administrator, to process the claims, but the employers are actually funding it. And in the US, most individuals are covered by employer sponsored plans. So a lot of the decisions about what gets covered and how much of it gets covered and how big your deductible is and how much cost share you have, those are decisions that are often made by employers because what they're tackling is, how do I help my employees be productive in the workplace and give them benefits that are competitive so that they stay working at my company and not another company. They stay productive in their day-to-day job. But how do I also at the same time juggle the challenge of I can't spend so much on employee benefits that I don't have money to invest in evolving my business or spending money on new technology. So, employers, as a payer behind the payer, are a highly demanding entity because they have to figure out how to balance the cost of paying for healthcare and the cost of growing their business. I'm reading a book right now by Paul Casaro, and it's about how the healthcare system will change in the next 10 years more than it has changed in the last 100 years. It's like, whoa, right? That's a big shift. And so I think that that can seem incredibly intimidating to those of us who operate inside this healthcare system, and particularly for clinicians. And so maybe what we can do is spend just a little bit of time on these factors that are part of the changes that are happening around us, these big system wide factors. When you hear things like healthcare will change in the next 10 years more than it has in 100 years, AI is a big driving force behind that because today there are so many systems and processes in healthcare that are highly manual in nature. Even just the way claims get paid by a payer, there's a lot of people and process and lack of automation behind that. And so I think we're going to see this massive automation in the administrative work that happens in healthcare, but that's also going to start to impact the ways that providers show up for their patients. How do you need to communicate with your patient? When are you communicating? How is AI extending your ability to communicate with your patient at 9 o'clock on a Saturday? So you're going to see, I think, a lot of change in that space just because the technology is different. Increasingly, in conversations with employers about mental health care, the thing that I hear talked about the most is navigation. It's this idea that there are now more people who want care in the mental health space and who are raising their hands and wanting to start care. And there are more options for care, whether it's things like digital self care or traditional therapy or support services. But the challenge that employers are struggling with is that they feel like their employees don't know how to go from one place in the healthcare system to the other place. In medical, all these different ways you can access care are often organized around a hospital system or a primary care doctor. And so that organization is kind of inherent in medical. It's not yet organized in quite the same way in behavioral health. And I think a big unlock that employers would like to see is these kinds of organized journeys of care that are easy for employees to engage in, easy for individuals to engage in. I know where to start, and I have a guide, maybe it's a therapist, who's guiding me along my care journey in the same way that a primary care provider might guide a patient along their care journey in medical. And so I think that's a really interesting unlock, and it's something that we're thinking a lot about here at Alma. So I am a healthcare nerd or a self-proclaimed healthcare nerd, watching always what's happening in the healthcare space, particularly what's happening in terms of legislation and other themes at the federal government level. One of the things that I think is important to pay attention to is what can get covered and how. So, recent legislation that was passed this summer changed the rules about what can get covered under high deductible plans. So, for example, high deductible plans can now cover virtual visits, including virtual visits for behavioral health, without having to first meet the deductible. So, what's often called first dollar coverage. Why this is important is because it has the potential to impact how employers position behavioral health benefits. Do you have to pay a deductible? Do you pay a smaller copay? And that in turn can influence what your clients might have to pay out of pocket. So important to watch this. Another thing I'm paying a lot of attention to is what's happening in terms of Medicaid funding. Why this is important, even if you don't take Medicaid patients, it's important because it has a trickle down effect on the entire healthcare system. If fewer people are eligible for Medicaid, that means more people are uninsured. When more people are uninsured, it puts stress on the system. It can result in more hospital closures in rural areas. It can result in hospital systems needing to close that gap by charging payers more for commercial plans. So even if you don't take Medicare or Medicaid, even if you don't participate in those programs, it's still really important to understand how government factors and programs like Medicare and Medicaid impact what's happening in healthcare. Employers will ask insurance companies they're working with, show me that the care that I'm paying for, whether it's therapy or whether it's other types of care, pharmaceutical benefits, anything, is that care helping to make people better? And so this is a question employers ask of insurers, and it's their job to be able to answer that. And so what they're simply trying to do is to figure out if the care that is being delivered in the therapy space, is that care working? So payers have to answer that question through data. And so often what we're trying to do when we're talking to our provider community about value-based care is to create the data points that show that the work you do has value. One of the things that I think makes Alma different is our focus on partnership. The partnership between Alma and the clinicians in our community and the partnership between Alma and payers. I think that when you know deeply your partner, and I'm sure the couples therapists will have something to add to this, but when you know deeply your partner, you can understand what motivates them, and then you can find ways to create value based on what's important to your partner. And so in payer relationships, we try to do that. We focus a lot on understanding where payers want to create value and then figuring out ways to deliver something for payers where providers also win. So let me give you an example. One of the challenges that payers struggle with is they want to make sure that when people use care, they choose providers that are in network. And they also want to make sure that the tools they deliver, like the payer directories that they make available digitally, are useful and high value. What payers often told us was, well, we're finding that people aren't necessarily going to our directory to search for care. They're going other places to find care. And so we saw a problem statement in that we thought we could uniquely address. And so over the course of the last couple of years, we've built a number of integrations with payer directories where consumers who come to those payer directories can click and find care and schedule care in the moment because we've made that integration possible with Alma providers. You as clinicians in turn get better matched to patients who are able to find you in real time and schedule with you in real time. So I think this is a great example of us knowing deeply what our payer partners needed and a business objective they wanted to achieve and figuring out how to do it with technology that also aided our provider community. One of the things I love about my journey here at Alma is I feel like I've had a front row seat to these massive changes in healthcare. And I think the first one was COVID. I think that you can't underestimate the impact of COVID for the behavioral healthcare community. I every day am astounded by how, as a community of clinicians, behavioral health therapists were able to go from delivering 95% of their care in person to delivering 95% of their care digitally through virtual platforms like Alma. And I am incredibly proud to have had that front row seat and to have been part of making it possible for clinicians to make that massive, massive change and to do it in a way that hopefully felt seamless and well supported because we were here to provide you with the technology and the systems and the support to deliver care in a different way. I think in many ways we find ourselves at the next crossroads in healthcare, and we are here to provide you with a seat at the table for how this transformation happens, and it happens in a way that's focused on you and your priorities.